surprise me. However, in just the people around me and the things that are happening, I can understand why those numbers, would be so high. Mental health and what it leads to, eventually bad decisions and mixing things or doing things, or it's mind boggling to me. But see what's changing in the world and how people react to things and things like that. I can kind of understand the numbers.
Well, I will tell you, one of the first things that comes out whenever I start to hear numbers or statistics as it relates to schizophrenia and bipolar, thus and so, that keep in mind that historically, and I want to say you really didn't start seeing the numbers being more reflective of the true case. But historically, the same behaviors exhibited by people with mental disorders who were white were diagnosed for bipolar and depression, whereas the same behaviors with Black, in particular Black men, was just sort of categorized under schizophrenia. And the meaning is that because of the spectrum where schizophrenia falls, there's much more negative association connotations, unfortunately, with John Q. Citizen as it relates to schizophrenia. It's the schizophrenia, it's people with schizophrenia who were most likely institutionalized. As of the mid-90s, we were getting away from the institution models. So now you're starting to see, like in DC, there's a historic mental health hospital called St. Elizabeth. When I was a kid, I can remember St. Elizabeth housing about 10,000 patients at any given time. As we sit here now, St. Elizabeth will never have more than 303 patients in it, because now, instead of having the institution that is out away from the community, like Buckner down in North Carolina and Bellevue in New York, we are integrating people with mental illness into the community. That's why you have halfway or community residential facilities, thus and so. But the reason why, as it relates to Black people, and keep in mind, once you got that moniker or that label of schizophrenia, then again, John Q. Citizen's fear and ignorance closed a lot of doors for those individuals. Mm-hmm. You would much rather have someone who is in a depressed state be your neighbor than someone who has auditory and visual hallucinations that can be pronounced to the point where they can be a danger to self or others. So those are the things that are kind of related to Black men. Listening to your numbers, it sounds like we're getting better because the numbers are more, how can I say, homogenous to what we would see with our white brothers and sisters, but again, we do have our own specific stressors and dietary things that kind of lends itself to physical and mental health deficiency. So.
Right. And it's interesting you say that it seems like it's getting better because there's more reporting of it. As we mentioned,
right.
Men are less likely to report, feelings of any mental health strain, but it is being reported more, and there's a lot more emphasis being put on it now. What you mentioned about the difference between how different groups of people have been diagnosed, how Black people were most often diagnosed as having schizophrenia, although they may have demonstrated symptoms of anxiety, depression, just like our white counterparts. Mm-hmm. That, which I had not realized was the case, that may have very well and probably did cause much of the stigma that we've experienced most of our lives as Black people in general. Mm-hmm. I remember being a young person, being a teenager, and, you couldn't talk about suicide ideation. You couldn't talk about feeling depressed. it was shunned upon. And I would hear adults say, no, Black people don't get depressed. No, Black people don't commit suicide. So there was this belief that you had to just kind of buck up and take whatever is going on. You weren't allowed to explore any of your true feelings about it. And I feel like that did us much more harm than good.
As far as the stigma, how they're so quick to label the negative stigma of schizophrenia versus it being actual depression or having anxiety, one of those lighter, behaviors that they will pass off to our white counterparts, if I should say, more so than African American, especially men. There's something that you just don't talk about ever. And so when you are labeled that, either you go to one or two places. You go to the crazy house or you go to jail. And so most of the time you won't even go to a sanitarium. They would stick you in jail where you get no help whatsoever.
And April, is an interesting point you make, because when you look at, and I don't know what the numbers are, but at the numbers of Black men that are incarcerated, and you have to know that many of those crimes were most likely rooted in some form of mental health issue, trauma, unresolved trauma. And again, these are things that have always been stigmatized in Black society rather than embraced and understood. But Steve, what did you want to share? You said you had a comment about the stigma.
Well, you had to keep in mind, we all, as humans, we are subject to our biases and perception. So I want to reiterate the point that even in the 60s and 70s, I think we had people who were doing their level best, but because they did not come from our communities and because they didn't look like us or have an understanding of our community or even have interpersonal relationships on the norms with people who look like us. So when a Steve Miller would come in and start to show depressive features or reclusiveness, then, okay, well, he must have a neurological disability. Whereas you guys can see me as an intelligent, articulate, jovial, social man. Okay, whereas, on site, that perception of who and what I am with people outside of my race and culture is very, very hard to break. So that's what I think lends itself more so. And then we as a people started to get access to education, go into the field, and then you had Black women, and then so you had all these different things because there was a disparity with Black women as well. That's when you start to see more of the leveling off of the numbers. You got to keep in mind, there's still a generation that remembers like institutionalized redlining and institutionalized segregation and those things that said, okay, you need to be over here or you need to be separate and apart. And what the numbers are showing is that those individuals have a form of post-traumatic stress associated with that. So even though, okay, now we're in 2015, 16, we had a Black president, you got Black quarterbacks, and all those things that they weren't accustomed to seeing growing up. But once they start to, when somebody says, okay, you can't do this, you got to wear a mask, or you can't go this place, that brought up old feelings. That was like a trigger, a psychosocial trigger to a large part of our community. And you had some people, that's why some people just did not respond well to it. And that's certainly not to say that all old people, but you saw a lot of people say maybe 65 and up who were kind of having that type of reaction to isolationism and social distancing. It triggered something that they had, a trauma that they experienced 30, 40 years ago. And it made it very new. And trauma will do that. If you can go 3 and 4 years, 30 and 40 years after a